I'm Enrico Coiera and I'm the Director for the Centre for Health Informatics at Macquarie Uni in Sydney, Australia.
So what do you think are the most significant challenges at the moment in health informatics?
I've started to realise that we've spent 20 to 30 years telling healthcare that it should be evidence-based and building the tools for evidence-based practice, and that health informatics itself is not an evidence-based discipline. If we look at the way systems are rolled out in the real world, there's very little attention to past experience, very little attention to the science of informatics, and so we have recurring challenges and major problems, not just in the UK, but really around the world. So I think it's about time we got serious about evidence-based health informatics.
And what do you think BCS could be doing to help things?
If we think about what it means to be evidence-based, it means to have a culture of valuing the evidence, of being able to ask questions and be able to produce research that answers those questions. That comes right back to training. So I think creating a culture and skill set around creation and use of evidence is what we're all about. It's exactly what's happened in healthcare, but we're only 20 years behind.
I've got one last question I was just going to ask you. What do you think are the main differences between the UK and Australian sort of health informatics kind of regimes?
I think Australia has a very much academic focus, research focus on academic and informatics, whereas the UK is much more pragmatic, practitioner focused. 20 years ago, when I was working in the UK, there was a really rich and strong academic tradition, and that seems to have, through NPFIT, become much more pragmatic.